Dr. David Kulla here with Synergy Wellness. Today I want to show you a patient, Haley here. She's given us permission to talk a little bit about her condition today. She has something called Costochondritis. And what it is inflammation of the joint where the ribs attach to the sternum, okay? Now, oftentimes Costochondritis can be aggravated by upper back or mid-thoracic problems, which she actually has. She has a lot of mid-thoracic pain, a lot of subluxations, misalignments in that thoracic area, and also her thoracic spine is very straight, so she doesn't have that kyphosis curve that we're supposed to have in the middle of the back. So that creates a lot of problems and has aggravated her costochondritis, the inflammation in the joints where, again, the ribs meet the sternum. But also, to complicate things even more, she has had chronic bronchitis, right? How long have you had it for?
For 5 years.
5 years. Chronic bronchitis, coughing and wheezing. She's an athlete, and it's been difficult for you to perform in sports, right, because of that issue. So what we had to do with her was first, and there you go. So she's just getting over a cold. There's something going around here in New York this week. If everybody's getting sick, you're just getting off the cold there. But what we're doing here with her is controlling the coughing and the wheezing and the phlegm. So we're using some products, some vitamins and supplements from Standard Process. And how have they been, aside from you getting sick this week? How have they been working for the wheezing and the coughing for you?
Good. So far I've been able to work out,
Okay.
get back to practice and everything.
Okay, so she plays team sports at her college, and that's been an improvement for her. But it's still not perfect, and obviously she's sick right now. But we've cut it down. How much would you say the wheezing and the bronchitis? How much improvement would you say you've had so far?
Like half, probably.
50%?
Yeah.
Okay, and she's been on the supplements, I think, about a month now?
Mm-hmm.
Okay, so the costochondritis has also improved, but now that you're sick again, she's having a little bit of a flare-up because she's been coughing, I guess, the last couple of days now?
Yeah.
Okay, so we're going to use some cold laser to calm the inflammation down in the rib area, and then afterwards we're going to adjust her and mobilize that thoracic spine. We also are working with her to do some stretches to get the curve, the kyphosis curve, back into the thoracic spine. So let's start the laser, and we have some protective goggles. Trust me, I don't wear these for the cool effect. All right. Just gonna go here. We're just gonna scan the where the rib meets the sternum. There are a few ribs that are a little bit out of place because, again, her thoracic spine is out of place. So the ribs wrap around through to the back and attach onto the thoracic spine. And when you have subluxations in the thoracic spine, which are misalignments in the thoracic spine, that creates subluxations in the ribs as well, misalignments in the ribs. So we're dealing with both from the front, the inflammation, and then again we're going to adjust her afterwards. And what we normally do is give her some heat on her upper back as well. So can you hold that for a second for me? Give you some heat. We use a moist heating pad. It's much more effective than the dry heat. And there you go, lay back. Okay. And the laser takes about 7 minutes. We have to do both sides today because she's been sick and coughing a lot. So we're gonna laser both sides because they're sensitive, right? Is it sensitive on the right and left? So cold laser therapy helps to make a cell wall more permeable, and it allows fluid inflammation to leave the cell. So, and also allows fluids to pour into the cells to help speed up the healing process. But right now we're really focusing on inflammation for her. Now, another thing that can cause costochondritis is arthritis. So some people develop arthritis in the rib cage area, and that can cause a lot of inflammation and pain as well. You need to cough?
No, okay.
Go ahead. And then we're going to switch to the other side. It's really important that the practitioner knows how to use these lasers. Otherwise, it's not going to hurt the patient. It's just not going to do anything for them. This therapy is very safe, extremely effective when used properly. Can you show me some of the areas that are sensitive? Just touch them right there. Okay. If you have any questions about cold laser therapy and what it can be used for, because it's not just costochondritis, we're using it for a lot of different soft tissue injuries. Feel free to comment below on the bottom here, the video, and let us know if you have any questions. Okay, so now that we've lasered the ribcage area, her right quad, now we need to get some motion in the thoracic spine. We put some moist heat on her back to loosen the spine up, or to bring more blood flow to the area, and also loosen the muscles up. And because she's been coughing, the muscles in her neck are pretty tight, and I can definitely feel a few misalignments here in the spine, which are called subluxations. It's a misaligned vertebra putting pressure on a nerve. And in this case, shifting her ribs out of their proper position, causing inflammation also in the front and pain in the front. Do you have any mid-back pain today?
Yeah.
Okay. Obviously with a strained quad, we want to check her lower back. And she's good. Her lower back is good. Does not need to be adjusted. Everything is balanced there. Sacroiliac joints are fine there, and we just adjusted your lower back the other day. And go ahead, take a deep breath in, and blow all the way out. You need a glass of water?
No, okay.
Okay. So if you're sick and you cancel your chiropractor's appointment, no bueno. Because when you're sick, you want your immune system to kick into high gear. You want your immune system to fight that cold, to fight that flu, whatever you're fighting. And an adjustment helps to increase and boost the immune system. So this is only going to help her. We'll wash the table down afterwards. Make sure nobody else gets sick. Take a deep breath in and blow all the way out. Okay, and I'm going to have you sit up and face the doorway, okay? Okay, so we're going to do an anterior adjustment here. A little sensitive right there.
Yeah.
Cross your hands or arms in front of you. Just like this. Good. Tuck your chin down. I'm going to have you scoot forward a little bit. Good. Okay, tuck your chin down. Take a deep breath in and blow out. Okay. So So she needs to load up on her euphrasia complex and her astragalus just to get through this cold. But you'll be much better off, I think, tomorrow and next day. Get through this, all right? We're just gonna check her neck and the mobilization in her cervical spine. A little bit of tenderness there on the left side. So what I'm doing here is just checking the range of motion in each of the joints here in the cervical spine. And just from doing this, I can feel where the joint's locked up right here on the left side, where she happens to also be sensitive, and also a little bit higher up here at C2 level. C2 has a nerve that exits right underneath that vertebra, and right above that vertebra, and that nerve right there, sensitive,
Yeah.
goes right to the sinuses. And I'm sure with her cold, she's got just a bit of sinus congestion. So I'm gonna go ahead and correct that. Okay. Relax here. Just gonna check her range of motion again. Is it sensitive here?
A little, yeah.
Still a little bit?
Yeah.
Okay. So we're just gonna do a little trigger point release in the suboccipital muscle. And I'm sure that spot right there is tender.
Yeah.
And take a deep breath in and out. Good. And in a few seconds, you'll feel that release. You may actually feel your sinuses clearing up already. You notice that you can breathe through your nose a little bit easier now. Good. And is that still sensitive right there?
No. A lot better.
And your hands up in the air, please. All right. There you have it. If you have any questions, feel free to comment below. Thanks.